Hundreds of millions of people around the world are impacted by addiction. In America, of the nearly 19 million individuals with substance use disorders, almost half have a diagnosed mental health disorder. With so many people in need of help and support, it should be easy to access appropriate care. But finding an ethical, high-quality, clinically focused treatment center is difficult. How do I know which rehab is the right fit for me or my loved one? Maryland Addiction Recovery Center was developed for that specific reason. To best support individuals and families suffering from addiction and co-occurring mental health disorders to find lifelong recovery. We view addiction as a chronic, progressive illness that requires long-term treatment to provide the best chance of a sustained recovery. Therefore, we created a multidisciplinary, comprehensive continuum of care treatment model that addresses not just the symptoms of addiction, but also addresses core underlying issues that interfere with the recovery process. Factors including attitudes, beliefs, family dynamics, mental health conditions, medical conditions, and trauma are uncovered, explored, and worked through. Our multi-phase treatment model supports gradual community reintegration and includes intensive vocational and academic support, as well as independent life skills development. Our comprehensive approach allows patients to begin living their lives with the recovery skill set to attain not just sobriety, but a meaningful and fulfilling life. We know what works. Long-term 5-year studies of medical professionals and pilots that include long-term treatment, monitoring, and engagement in recovery-oriented community supports demonstrate 75 to 80% or greater success rates. So how do we bring that level of success to the everyday consumer? Further studies have consistently and clearly demonstrated 2 essential factors related to successful outcomes: length of treatment and family involvement. Brief treatment episodes can often lead to quick relapses. Therefore, a chronic illness like addiction requires long-term care. Shifting strongly established behavioral patterns and beliefs takes time and requires clear thinking, stabilization of mental health symptoms, and a strong support system. We have incorporated these scientific findings into our long-term community-based treatment model through multiple levels and access points to care that in turn promotes the opportunity for genuine change. Family involvement at Maryland Addiction Recovery Center is a crucial component of our treatment approach. Addiction impacts every member of a family, and our services aim to foster health and emotional well-being throughout the family system. Individuals whose families are invested in the treatment process and embrace their own recovery pathways help to better ensure and support long-term recovery for their loved one. The comprehensive addiction and co-occurring treatment services offered at Maryland Addiction Recovery Center include well-established and proven therapeutic interventions, as well as the latest innovative clinical and medical therapies and approaches. Our dynamic and dedicated staff work daily to provide an environment that fosters growth, healing, insight, and connection. Each component of our treatment model plays an important role in the recovery process and ultimately helps individuals create lives with direction and purpose. Maryland Addiction Recovery Center, redefining the addiction treatment experience.